Extract 1. Questions 1 to 12. You hear a lactation consultant talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Thanks for coming in today. I'm Kenzie Fair, the lactation consultant.
Hi Kenzie, it's nice to meet you.
So, Mihiraa, what brings you to the clinic today?
I'm concerned about my milk supply. My baby seems hungry all the time, and isn't gaining weight as quickly as the pediatrician would like.
I understand. Before we go further, can you tell me a little about your own medical history? Have you had any previous surgeries or conditions that might affect breastfeeding?
Negative, there are no significant medical interventions or conditions affecting my overall health.
Okay, and how was your delivery? Did you have a vaginal birth or a cesarean section?
It was a vaginal delivery, but it did go a little long. The baby ended up needing some assistance coming out with forceps.
Interesting. Now, can you walk me through a typical breastfeeding session? How often do you feed your baby and for how long?
I try to feed him every 2 hours, but sometimes he seems unsatisfied and wants to nurse more often. I usually let him feed for as long as he wants.
And Mihiraa, how many wet and dirty diapers does your baby have a day?
Maybe 6 or 7 wet diapers, but only a couple of poopy ones.
Have you noticed any pain during breastfeeding? Are your nipples cracked or sore?
Yes, indeed, they occasionally feel tender, particularly at the start of a feeding session.
Okay, Mihiraa, thanks for being so open. There are a few things we can discuss that might be affecting your milk supply, including your delivery and latch issues due to sore nipples.
Okay.
I'd like to observe a feeding session if that's all right with you.
Yes, that's fine.
Thank you, Mihiraa. Well, it looks like your baby might not be latching deeply enough to effectively transfer milk.
Oh, no. What should I do?
Don't worry, this is quite common. We can work on some techniques to improve your baby's latch and help increase your milk supply. I can also recommend a gentle nipple cream, lanolin, to soothe the soreness.
Is it safe for my baby?
Absolutely, Mihiraa. This nipple cream is safe for your baby. It's made from natural ingredients and is specifically designed to soothe and protect sore nipples without harming your baby. Just make sure to apply a small amount and ensure it's fully absorbed before breastfeeding. If you have any concerns or if your baby shows any signs of sensitivity, we can explore other options. Your baby's health and safety are always our top priority.
Okay, that's fine.
Mihiraa, we can arrange a subsequent consultation in 7 days to assess the efficacy of the implemented interventions and monitor the ongoing progression of your lactation and breastfeeding journey.
Sure, why not?
In the meantime, there are some resources I can give you about proper latch technique and increasing milk yield. Do you have any questions for me today?
Extract 2. Questions 13 to 24. You hear a sports medicine physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. So, what brings you in today?
Hi, Dr. Clarkson. Thanks for seeing me. I actually sprained my ankle pretty badly playing basketball yesterday.
Ah, I see. These are quite common with sports injuries. Can you tell me a little more about your medical history? Have you had any previous injuries or surgeries?
Not really, doctor. I'm generally healthy. I did have a minor fracture in my right wrist a few years ago, but it healed completely.
Okay, good to know. Now, can you describe the fall in more detail? Did you hear any sounds, Mihiraa?
Actually, yes. There was a sharp pain and a popping sound when I landed on my ankle. I couldn't put any weight on it at all.
That's concerning. How would you rate the pain on a scale of 1 to 10, with 10 being the worst?
Right now, it's about a 7. It's throbbing and feels quite swollen.
Alright. Let's take a look. There is definitely some swelling and tenderness around the outer ankle bone.
Yes, doctor. There is.
Mihiraa, let me move your foot in dorsiflexion. It is a movement where I gently bend your foot upwards towards your shin, which helps assess the flexibility and range of motion in your ankle. So, may I have your permission to perform this movement to evaluate your ankle function?
Okay, you may please.
Is there any pain when I move your foot in this direction?
Ouch, yes. That definitely hurts.
Okay, that suggests there might be ligament involvement. Mihiraa, I'd like to get an X-ray to rule out any fractures.
Sure, that sounds good.
Mihiraa, the X-ray is clear, which is good news. Based on the exam and your symptoms, it seems you likely have a moderate ankle sprain.
Okay, so what does that mean for me?
The good news is with proper treatment, most sprains heal completely within a few weeks. The key is rest, ice, compression, and elevation. I'll prescribe you an ankle brace for support and some pain medication to help manage the discomfort.
Great. When can I get back to playing basketball?
Well, let's prioritize healing first. I recommend avoiding strenuous activity for the next 2 weeks. Mihiraa, we can then discuss a rehabilitation plan to gradually strengthen the ankle and improve your range of motion.
Sounds like a plan. Is there anything else I need to do?
Definitely, Mihiraa. It's important to keep an eye on the swelling and any potential signs of infection. If you experience increased redness, warmth, or fever, come back immediately. I'll also give you a referral for physical therapy to work on regaining strength and stability after the initial healing period.
Thank you so much, Dr. Clarkson. That's very helpful.
You're welcome, Mihiraa. Should you have any inquiries, please feel free to contact us. We anticipate seeing you in a fortnight for your subsequent follow-up appointment.